Okay, good afternoon, everyone. And thank you so much for joining us today. I think more people will join us in some time, but we can start with just an introduction and just what we are planning to do today. Just give me a minute. Yeah. This is so for those of you who don't know me, this is Dr. Vinita Matthew, and I'm from Ashok and Ashok One Hospital in Dahisar, Mumbai. And today we are celebrating the International Day of Older People. And this year the theme is aging with dignity and the importance of strengthening care and support system for older persons worldwide. So that's what is the theme for this year. This is decided by the UN, and it is estimated that by 2030, older people are projected to outnumber the youth globally. Okay, so and this is going to increase rapidly in developing countries. And as we start aging, there will be much more need for support systems. And we thought it was a good idea for us to start talking about this and start engaging people in the community. And that's why we decided to bring this, kind of a theme for an awareness among all of us. Those of you who have joined, thank you so much. Today we have with us two people. That is, one is Dr. Manoj Jacob, as many of you all may have seen on the flyer. He will be introduced shortly. And we also have Sharon. Sharon is part of our team. She's a psychotherapist and she helps us with the psychosocial aspect of all the patients, inpatients as well as outpatients in Ashok and Ashok One Hospital. Sharon will be introducing Dr. Manoj Jacob. Manoj Jacob is based in Kochi, and she will give us a brief about who he is. And we just have basically Sharon will, as a psychotherapist, she comes across many things that she sees needs to be addressed, especially with the older population who gets admitted in the hospital, as well as the caregivers. So the caregivers need to kind of be supported during the time, and they are giving care to the older people. So Sharon has quite a few questions. So it will be a question and Q&A between Sharon and Dr. Manoj. And after Sharon finishes her questions, we will open it up for others, rest of us to also ask questions. So keep your questions in mind. You can also put it in the chat box whenever you remember it. Sometimes the questions get answered during the course of the session. But if it is not answered, we will pick it up and we will talk about it later on. Okay, so I'll hand it over to Sharon and then Dr. Manoj also. Thank you so much.
Thank you, ma'am. So, first of all, am I audible? Yeah? Okay. First of all, I just want to wish all the older persons in the room a very happy International Day for Older Persons. We really want to celebrate you and know what you've done for us in the society and the value you add to us. And yes, so today we have Dr. Manoj C. Jacob with us today. He's a consultant geriatric physician at Sunrise Hospitals, Kochi. So he worked as a physician for 10 years, and then he felt called to focus on the the care of older adults, and address their special needs. So he has done a training. He has had his training in palliative care and geriatric medicine. He's done his geriatric medicine training from CMC. And he started an elder care center, Pratyasha Elder Care Service, which is dedicated to the needs of older persons in Kochi. So, and in addition to all the comprehensive assessment and care, he also is specialized. He gives a specialized geriatric home care to people who have limited mobility. So he comes with 25 years of experience, which includes more than 10 years of experience in palliative and geriatric medicine. So thank you, Dr. Manoj, for doing this with us. Welcome to this session.
Yeah, thank you, Sharon.
Yes. So as Dr. Vinita said, we have the majority of the patients we have here at Ashok One are older adults, senior citizens. So that's why we thought, it's important to address this day and talk about older persons and their challenges. So if we see, this year's theme, um, so this is the 34th commemoration of the International Day of Older Persons that we're celebrating, the UN is celebrating. And the theme for this year is Aging with Dignity, the importance of strengthening care and support systems for older persons worldwide. So Dr. Manoj, I would like to ask you, with regards to the theme for this year's celebration, what would you think about, aging with dignity? What would it mean for you?
Yeah, thank you, Sharon, for the kind words of introduction. And I'm thankful to the organizers for this privilege to share some of my insights and my experiences in caring for the older persons. Um, Dignity is a very important aspect, a value of that every human being desires. A desire to be honored, a desire to be respected, a desire to be valued. Now, when a person gets old, there are certain things that happen to him that makes him feel inadequate, feel inferior, or has a decrease in his sense of self-worth. For example, a very highly placed official who had a lot of power and authority suddenly retires, and overnight he becomes a nobody. He loses all his power and authority, and nobody values him. Or, for example, somebody has a physical limitation. He has difficulty in walking, and he needs someone to hold his hands and make him walk. Or somebody has a memory impairment. He can't remember what he what he what he had in the morning, or can't remember something that's so important for day-to-day functioning. Now, in these situations, the person himself feels undervalued, feels that I'm not good enough, that you know I'm not worthy enough, and so it's a sense of worthlessness, a sense of loss of purpose in life can all come in. And so there are two things that are important. One is for the person himself to prepare himself to a to getting old and have these limitations. That's number one. And number two is the person who is his family or his friends or his community around him also needs to envelop him in such a way that he does not lose his dignity. I hope I am clear.
Yes, yes.
Now, for example, I'll tell you. Um, for example, somebody has a difficulty taking a few steps. You can belittle the person and say, "Oh, you can't even walk so much," or somebody suddenly forgets somebody's name, and you can easily make fun and say, "Oh, you can't even remember this person's name. You've seen him yesterday. He came, and this morning he came." Or somebody is we sometimes hold the cheek of an older person. We kind of infantize them. We infantize them. We make them feel childish. So these are all things that are so important, that we should be careful. Sometimes patronizing over them, shouting over them, not giving them the independence they need to do things on their own. We try to interfere in every decision making, forgetting the fact that till yesterday this person was a person with authority and doing a lot of things. And overnight, when everyone around him decides what he should do, it's not easy for him to accept it. He loses his dignity. So they rebel, they become angry, they become irritated, you know. So I think these are all very important facets to, um, you know, to giving them the dignity they deserve, the respect they deserve. And that will go a long way in improving their confidence and sense of purpose in their lives.
True. I truly agree with that, because yeah, the patients that we see here also, a lot of them, especially after retirement, they, that till that time their sense of purpose came from their work, the job that they did, and suddenly that they lose everything. And so yes, as you said, it is very important that they actually, prepare for retirement, you know, have a plan, like, and it's not just that individual's thing. I mean, the family also should involve in it and be sensitive in that way. As you said, not to belittle them, but to still give them that independence that they need,
Yeah.
and give that respect to them. Yeah. Thank you for sharing that, Dr. Manoj.
Yeah.
In the fact that you yourself felt a calling to, uh, specialize into care of older persons and their needs. So would you mind, sharing with us as to what led you to your calling?
Yeah. I worked 10 years as a physician taking care of all medical problems. Then I took a break for about 7 years working with an organization where I didn't do much of medical work, but focused on little bit of palliative care, especially
Mm-hmm.
cancer palliative. But when we came down to Kerala in 2017, um, uh, is my slide clear?
Yes, yes, we can see.
This is my dad. I would say he was to a great extent instrumental in my movement into geriatric medicine.
Mm-hmm.
We came down to Kerala because he was a very strong, healthy person with no diabetes, no hypertension, no heart disease, but he was affected with Parkinson's disease, and not the typical Parkinson's, atypical Parkinson's. So that really, over a few years, he became bedridden, and he could not move, he could not feed himself, he had to be fed through a tube, and he had to be, his pass bowels and urine in the bed. So it was a 5 to 6 years of totally dependent existence, and me and my wife had the privilege to take care of him. We had caregivers who were there to help us, and they were really very good. So that way we didn't feel very burdened, but on the whole we were overseeing his care. And this is the um, yeah, this is a picture of him towards the end of his life. Before
Mm-hmm.
his A few days before his home call, he had become totally rigid. His elbows, his wrists have all become, flexed. He had become skin and bones. So we had to put him in a care home for a few weeks uh, towards the end of his life. Not really towards the end of his life, somewhere in the middle when we needed a break. So, so I think this was the experience I got from caring for him, and the the struggle that we go through caring for our dear ones made me
Mm-hmm.
think maybe I should consider geriatrics as an area that I can specialize and develop. So this
Mm-hmm.
basically is the reason for my movement into geriatric care.
Okay. That's That's beautiful to hear, because yeah, as a caregiver, you've had that experience of caring for an older adult, being your own father. Yeah. So
I just want
uh,
to add one more thing.
yeah.
It was not easy caring for him, uh,
Mm-hmm.
especially to see him every day like that with no response, and
Mm-hmm.
cleaning his bowels, and we clean up the bowels, and then suddenly he'll pass again. And so it was not easy. It was
Mm-hmm.
always difficult, but out of something painful, I think God did something beautiful. So I think that's the story.
That's good to know. Yeah, actually, it's from our brokenness that God prepares us to help others as well. It's beautiful to hear that. So, as you having been a caregiver to your father, and with your the experience in the field of geriatric care, what would you be able to share some insights, with the older persons and their caregivers about taking care of their health? How the older persons can take care of their health? What advice would you give someone who's in their 50s or 60s to ensure that they, age gracefully with dignity and maintain a good quality of life, and how caregivers can help support them?
Shall I also include the common problems that they have,
Yes, yes,
and then go
definitely.
on to that? That might make it easier.
Yeah, sure.
Now, see, if you look at common diseases that older people have, they have communicable disease and non-communicable disease. Communicable disease would probably mean those which can be through bacteria, virus, and those kind of things. And the commonest three would be flu, urinary infection, and pneumonias. These are the three very common infections we see in older people. In addition, they have hypertension, diabetes, heart disease, dyslipidemia. Dyslipidemia is all this cholesterol and those related problems. And they can have strokes. Heart disease could mean heart attacks, chest pain. Strokes would mean weakness or paralysis of one side of the body or one side of the face and those kind of things.
Mm-hmm.
And then there is something called geriatric giants. There are 5 common problems that are seen in older people. So I will just show you those 5 quickly, and then I'll then go on to.
Sure.
Now these are called the geriatric giants, all starting with I. The first is called instability. Instability is where people have difficulty in walking. They're not stable, and they're not very good in their balance, and they can fall. Okay. Second is what we call incontinence. Incontinence is where they sometimes leak urine. Where they sometimes leak urine, either knowingly. I mean, either while coughing or while straining, a few drops fall, or they can't control the urination. They can't hold the urine. Unknowingly, some urine passes. The third I is called immobility. Immobility is difficulty in walking. For example, somebody with Parkinson's, he slowly loses the ability to walk. They become stiff in their body and they become bedridden. Then there is something called impaired memory. This is what is called, you must have heard of this word dementia, where people slowly lose their memory and their cognitive abilities like reasoning, language, those kind of things. And finally is the iatrogenic. Iatrogenic is where they take multiple drugs from multiple specialists, cardiologists, neurologists, urologists, different gastroenterologists. All of them will have some medicines for this person. So there is an interaction between these medicines, and that can cause problems. For example, somebody with antihypertensive drugs can have a low BP and can lose his balance and fall. Or somebody with some kinds of antihypertensives can have swelling of the legs. So these are the 5 geriatric giants which are commonly seen in the older people. So when we talk of what do we do to prevent some of these problems, I will go to the first one. Communicable urinary infections. You can avoid urinary infections by drinking a lot of fluids. Keeping your the area clean. And make sure that if you are diabetic, your diabetes is well controlled. So all these are good ways to prevent urinary infection. Now, pneumonia and flu in older people there is a vaccination available which can be taken to prevent pneumonias. This vaccination has to be taken once, then the repeat second dose after 1 year, and then every 5 years. That really helps people to, especially diabetics, those with lung diseases like, asthma and those kind of problems are very prone to develop pneumonia. So it's good to take a vaccination for that. A flu vaccine is available. Older people, you can have flu vaccination. Flu vaccination is helpful, but only problem with flu vaccination is that you have to take it every year, once every year. So that will prevent all these common colds and those kind of things, which can actually, in an older person or a diabetic person, can sometimes lead on to pneumonias.
Okay.
Now, in terms of these lifestyle diseases, hypertension, diabetes, heart disease, lipidemias, I think the only main important thing is detect it early, treat it properly, bring everything under control, and identify complications early. For example, diabetes who is having a renal problem, a renal complication, or eye, for example, they can have some complications in the eye. So if you pick it up early, you can treat the problem and you can prevent a blindness. But if you don't identify the complication, it can sometimes lead to blindness. Or diabetes not well controlled can also produce kidney problems. Hypertension not well controlled can lead to a stroke. You can bleed in the brain, or you can have a clot in the brain. So these are all, and cholesterol, if is not well controlled, it can get deposited in the arteries, and that can actually produce blocking of the arteries, blood supply, which can produce a heart attack. So for these lifestyle diseases, the bottom line is pick it up early, treat it adequately, and identify complications early enough so that you can prevent any catastrophic problems.
Okay.
So I think this is just a few things about that. Then about lifestyle, I'll come to lifestyle. This just to show you falls. People are unstable. The commonest problem with older people with the unstable is they can fall. And one common way they fall is by tripping over objects on the floor, or there is a carpet on the floor which is folded, one corner is folded, and their leg goes into that and they fall. Or they wear footwear which are slippery, or there's a water lying on the floor and they slip and fall. And for an older person, one fall is enough to make them totally bedridden. They usually fracture the femur, the bone, and if you don't do a surgery for that, they become totally bedridden. And once they become bedridden, they develop bed sores, and then there's a downhill course. So it is very important that falls in older people are avoided at any cost.
Yeah.
Number two, the other problem is once they fall, they have a fear of falling.
True. Yeah.
And they slowly stop going out of their homes because they said, I'm afraid I'll fall. And that produces social isolation. And that can produce depression. You understand?
Yeah.
Once they don't connect with people, they get depressed. So fear again is one reason that people have which makes them immobile. And once they become immobile, what happens? Once they become immobile, they become bedridden. And once they become bedridden, there are other problems associated with that. This I am not touching this, just to tell you about dementia. This is the brain, and this is the disease of forgetfulness, where people forget. For example, these are a few questions that they ask, which sometimes they just forget. How do I turn on the lights? When they see a girl, they see a daughter. Is this my daughter? Or they just forget where the bed is to sleep. Or they taken the morning pill. Did I take the pill? They forget very recent events. Sometimes spouse will forget the name of the husband or their wife. These are certain. If you find some of these symptoms in older people, you should suspect early dementia. Now there is another example they say is, now when you show a key to a normal person, he will be asking, is this for the bedroom or the guest room? Or if he lost a key, he will think, oh, where did I keep the key? But a person with dementia will be wondering, what is this? He does not identify that this is a key. And he even forgets what he has to do with the key. You understand? So this is
Yeah.
the way a normal person's thinking and a person with dementia, they forget even common things they forget.
Mm.
Now, there are a few preventable causes of memory loss, B12 deficiency, and thyroid problems and depression. These are three things that also can produce temporary memory loss. So,
Mm.
whenever you suspect memory loss, always check for thyroid functions, check your B12 levels, and if you are depressed, treat for depression. And they also say that I was asking about lifestyle changes. They have found a lot of studies were done abroad, and they have found that these few steps, if taken, helps to prevent or delay dementia. Stop smoking, keep alcohol to minimum, healthy balanced diet, including at least 4 or 5 portions of fruit and vegetables every day. That means you need to take adequate amounts of fruits and vegetables every day. Exercising for at least 150 minutes every week. Blood pressure check and control of blood pressure. Diabetes control and diet and medication. And if with these basic things, they have found that uh, I don't know many of you have heard of the nuns study. A scientist did a study among 673 nuns in a convent, and he also did a study and found out certain reasons that certain nuns don't develop dementia while some others develop dementia, and there are a few conclusions he makes. Loneliness, they say, is one very common cause for dementia. Sedentary lifestyle, not doing anything, sitting at home always, without any movement, exercise, again, is one cause for dementia. Untreated depression, hearing loss. And so these are a few tips that I can give. They say that if you are following these basic principles, you can delay or prevent dementia to a great extent. And they've also found that people with very early memory loss, actually, their memory improved by strict following of these guidelines.
Yeah. Yes.
And I don't think I need to share about this, just a few things. Sorry, 1 minute. Just show you a few things about diet and exercise, which also is very important. As I told you, smoking is stop smoking. Body weight has to be, minimum radiation. That 10 years not very common. Increase exercise is very important. Aerobic exercise includes walking, cycling, those kind of exercises. Muscle strengthening exercise is also very important. Muscle strengthening exercises would mean, lifting up small weights with the hands, doing some weight exercise with the legs. For older persons, you can do limited muscle strengthening exercises and stretching, because for balance, it's not just enough to do walking and cycling. You need, because the muscles slowly become atrophied. The volume of muscles become less as you grow older. So when you exercise the muscles, it helps to regain the strength of the muscles. So muscle strength exercise is also very important, and moderate physical activities. And regarding diet, I don't need to tell you. Saturated fats to be avoided as far as possible, which includes all the oils. Avoid as much as possible. Trans fats like dalda and those kind of things, is better not. The bakery items, they say, are very harmful. There's a lot of trans fat in all these bakery items. Increase intake of fruits and vegetables. Sodium intake, to minimize it. You can take a normal intake, but not extra too much of salt. Many of these items like papad, pickles, all these potato chips, all this, like food that you get in the shops, this KFCs and all those kind of food have a very high content of sodium. Pardon?
The
Fast
processed
foods.
food.
Fast foods, yeah.
Yes.
So all these have very high content of salt. So it's better to restrict it. Not that you should not take it at all, but restrict it. Don't take it too much. And adequate calcium. And they say that vitamin D is produced in the body when you get exposed to sunlight. And 11 to 3 p.m. is the best time to expose to sunlight. which will give you adequate vitamin D. Anytime, half an hour every day for between 11 and 3 is the best time to get vitamin D. If you don't have vitamin D in the body, you can have aches and pains and tiredness and all those kind of things. And if you don't have vitamin D, the calcium you may take a lot of milk, but the calcium doesn't get absorbed. So if for absorption of calcium, you need vitamin D. So it's good to check your vitamin D once a year, once in 2 years, or once. And these are a few tests that preventive, nowadays we have all these expensive executive checkups, which we don't know whether it's very helpful. Maybe you can do it once. But more than that, annual medical and dental checkup, blood pressure, sugar, and those kind of things.
Yeah.
Check your cholesterols, once a year. Check your HbA if you're diabetic, or if you're above 50. HbA1c is a test that helps you to know whether you're diabetic. And for women, they say that it's good to do a mammography. Mammography is to check the breast for any lumps and breasts. And pap smear is a test that they do for cervical cancer. Every 5 years for those above 50. It's good to do a screening for them. And for those who are having a family history of colon cancer in the family, it's good to do a stool test every year and a colonoscopy every 10 years. Because those with the family history of cancer colon have a high incidence of possibilities. So it's good to check. And bone density, to check your bones, whether they're strong enough. There is a scan called DEXA scan. You can do it after 16 ladies and after 17 men. So if your bone is very thin, a trivial fall will produce a fracture. So you need to take medicines to strengthen your bones. And aspirins and statins, if your cholesterols are very high, then you can consider taking statins or medicines. So basically, I think this would cover basic guidelines to healthy aging.
Right. Yeah. Thank you, Dr. Manoj. Yeah, I'm sure there are caregivers, the family members also joining us in this call. So they also can, be aware of what they can help their adults, older their parents with, the guidelines, especially the regular for the checkups and the follow-ups. So something that we've seen here in the hospital is also, patients, for example, if I take, diabetes, patients who are taking the diabetes medicines, once they feel they're okay, they just stop the medicine. So something we tell them is, don't just do it on your own. I always consult your doctors, and then, keep doing the regular follow-ups and keep asking your doctor. And when they share the histories, when they can know, like how you said about if they have a history of colon cancer, when they share all these important history with their physicians, with their consultants, it's when they can prevent, as you said, a lot of these lifestyle diseases can be prevented, even dementia, which is something that we say, not curable, but it can definitely be prevented by the measures that we can take. Thank you for sharing that. And you also mentioned about how in the falls, the imbalance that patients feel, and the fear they have after they've had a fall. And then that leading to immobility, and then they being bedridden, and the part where you said about depression and the loneliness that they feel, the social isolation, right? So we often see, that there is a overlap of this mental health aspect to the general health of patients, right? So would you, share on that aspect as well? How does mental health, affect the person's overall health, and what has your experience been in
that? Mental health is often overlooked area when older people come to physicians with symptoms that are sometimes very vague: aches and pains, insomnia, difficulty in sleeping, or breathing difficulty. You've done everything and you find there's nothing to suggest to find the cause for the breathing difficulty. And so often physicians overlook that and give them some sedatives and send them. So it is very important for us to, especially people above 60, to consider depression and anxiety are very common problems that are there due to various reasons. Depression because they may have lost a spouse, they may have had a problem with not having enough financial resources to support themselves. The children are not looking after them well, or they're having a fear of the future, a fear of death, fear of becoming bedridden. So all this can trigger anxiety and depression in people who are old. So we have to be very, very sensitive and very very proactive in picking up the cues that they give us. It will not be obviously it will not be. They will not come and tell you I got a mental problem or I'm feeling depressed or I'm feeling fearful. That's below the dignity for a person to come and tell you that. But they'll tell you everything else. Aches and pains. Difficulty in walking. I don't feel like getting up in the morning. I'm feeling very tired, exhaustion. So various symptoms. So whenever you come, I think for doctors and for healthcare professionals, whenever you see these symptoms in people who are old, you can do. There are certain questionnaires available. I mean, you must be aware of it. There is something called a geriatric depression scale. There are about 15 questions that you can ask them, and based on that, you can grade put a scoring. And if it's more than 5, it's possible depression. If it's more than 10, depression. And if it's more than 12, severe depression, those kind of things. So you can use certain tools to actually pinpoint and specifically have objective criteria, which will help you to identify the problem and then give them the support that they need. It will include both therapy and medication. Many of them would need medication, and they do very well with medication. So I would underline and say that mental health is something that is very, very important, because if their mental health is not right, is not good, emotional health is not good, they become burden to themselves and to their family members. But they don't eat, they don't cooperate with the family, and so it becomes a big burden on the caregivers also. So I think this is something that's important.
Yeah, true, very true. And I think the concept of holistic care, is becoming very important in geriatric medicine, where the mental health aspect also comes in play, and the social aspect. When you talked about the isolation aspect. So our hospital is also, looking at that the holistic care of patients, what we call the total person care. And like you said, the physicians here, if they are able to identify all those symptoms, like when the reports are all normal, even when they're having physical aches, the doctors do refer them to what we call the support team, who does this psychosocial assessment of patients, where we ask them about their family, their the sleep patterns, their appetite, all those questions, which also comes in the depression scale, about any suicidal thoughts, or just generally how are they doing, generally what is their routine like. So this is something that we do in Ashokman as well, looking at the whole person care aspect. So, sir, you have also been a trainer in the whole person care aspect, right? Yeah, you wanted to share something?
Yeah, coming to whole person care, it includes not just the physical aspect of care that we normally provide, but like you rightly said, emotional health, social factors that involve community around them, the family support, the psychological aspects, mental health, and also the spiritual aspects.
Spiritual aspects.
Even right. WHO, when it defines health, it brings in this spiritual also as a component. In many of the European countries, the cancer societies, in their definition of holistic care, they have all included spiritual health. Spiritual health does not necessarily mean of one religion, but this whole aspects of faith in God. I'll tell you one small example. I think can I share a small story?
Yes,
I had a
definitely.
gentleman who was a retired army officer, and he was
Mhm.
having advanced cancer of the prostate, and he was almost nearing his end. I had been seeing him for almost a year, and then
Mhm.
towards the last, he said, Doctor, would you come one more time? I don't think I will last very long. So I said, no, I don't think I can come again because I'm going out of town. I'll be away for 2 weeks.
Mhm.
Then he said, Doctor, can I share something very private to you? And he made me close the room and shared
Mhm.
something very, very personal. He said, I've been
Mhm.
unfaithful to my wife. Will God forgive me for that?
Mhm.
And he said, I've been struggling with this question for many years, especially after he
Mhm.
developed cancer. And
Okay.
then, he was a Christian, so we could pray with him and he could
Mhm.
ask forgiveness for his sin. And, at the end of the prayer, he said, Doctor, I'm ready to die. He said, I'm ready to go.
Mhm.
And that midnight, he passed away. And his wife
Wow.
told me that he died very peacefully without any struggle.
Mhm.
So I'm telling you, when you talk of whole person care, there are
Mhm.
many of these aspects which are there in people's hearts:
True.
unforgiveness, bitterness,
Mhm.
having done something very wrong and they're wondering if God will punish them for that after they die. And
Yes.
so I think it's good to explore some of this. In many
True.
places they take a spiritual history. You can like
Right.
you take a
Right.
medical history, you can take
Right.
a spiritual history, asking them what do you think about God? Do they have a
True.
personal faith in God? What do you think
Mhm.
about death? What do you think about what happens after death? So all
Yes.
these questions help us to get a picture of where they stand in their spiritual journey,
Right.
and so it helps us to bring them to some clarity on, and they are prepared better for the end.
Right.
So when I talk of whole person care, I mean this kind of things where
Yes. Yes.
you're covering every aspect of their thing. But
Right. Yeah, I'm happy that you mentioned the spiritual aspect, Kavya. I missed that point, but yeah, that is something also we do here. Like you mentioned, the spiritual history. We take the spiritual history with patients as well, and we've seen, sometimes we're hesitant to do that, but then we've seen that when we actually do it, there's a deep conversation that happens during that time. When we do that spiritual history, there's a lot of questions about God, as you said, the fears they have, some regrets they've had in life, or just that relationship with God where they want to make things right. So that's really beautiful, that you spoke about that. Thank you. So for one last question, Dr. Manoj, I would ask you, we've seen many families, struggle with decisions about long-term care for their aging adults, the parents or their relatives. So, what advice would you give to families when considering options like home care, assisted living, or nursing homes? Because we see, we live in a society where we have like constructed ideas about old age homes and things like that. So, would you
yeah,
also share about it?
um, being in Kerala is a different country because there are no young people, very few young people in Kerala now. All the young people are migrating and going abroad. And
Hmm.
so they say in the next 10 years, there will only be empty homes or old couples in
Sad.
homes with a dog and a caregiver. So this is what is going to happen in the next 10 years because young people are migrating left and right. And
Hmm.
like our present generation, that is people like me who are in their 60, I mean, I'm 60, people who are in their
Hmm.
60s, definitely we are going to see a big vacuum in the coming 10 years where there
Hmm.
will be no young people. So people have no option. They will either have to have a person who will be at home caring for them, and cooking for them, maybe one cook and one caregiver. But it's very expensive. One caregiver in Kerala will cost you anything between 25 to 30,000 per month, and
Hmm.
a cook will cost you another 25,000. So families can't afford having two people, one for cooking, because caregivers won't cook. They'll only provide the caregiving. So that is one. The only other option is when they become immobile, when they become bedridden, they have no other option but move into what we call assisted living facilities or hospices. Assisted living facilities is for people who are moderately mobile. They can still walk around with a stick and those kind of things. They just need some assistance. While hospice is a place where people are totally bedridden. They can't move, they can't feed themselves. They need 24-hour care, round the clock care. So there are different levels of, I don't know what is the situation in Maharashtra and those kind of states there where the young people are still there, joint families. Kerala, there is no question of joint families. But in North India, there are still joint families. So there will be some young people in the families who would be there to take care of the older people. So it varies from state to state.
State to state, yeah.
But I think slowly we will probably be coming to a stage where parents will have to mentally prepare themselves not to be looked after by their children, and also mentally be prepared to move into homes, retiring homes or assisted living facilities, and children not to feel guilty for having to put them in these homes, because there is a lot of social ostracism when somebody puts a parent into a home. Everybody, neighbors will tell what they don't care for their family, they don't care for their parents, they put them in a home. But Kerala, slowly it is becoming part of the thing because there are no children. They all have a job abroad and they can't find jobs. Kerala is a very small state. There are no jobs here. So people are all going, and so they can't leave the jobs and come and take after their parents here. So, it's a very complex issue. I mean, it's not easy. The government has to come into the picture, social NGOs have to come into the picture, community around has to come into the picture, political decisions have to be taken. So it's a very complex issue. I mean, there are no easy answers. But the bottom line is, in the coming 10, 15 years, we will slowly be moving into, caregivers at home and not family. And maybe at some point even moving into assisted living facilities or retirement homes, and maybe at a later stage move into a hospice where you are taken care of. Now what I do is I provide home care at home. I visit older people at home because they can't come to hospital, and whatever is possible at home I manage at home. Whatever is not possible at home I bring them to the hospital. So we have a system like that.
That's great to hear. As in here, as you mentioned, it differs from state to state, and I think that what you were speaking about is there needs to be a shift in the mindset that needs to come. That the acceptance to just be independent, even as adults, even as older adults, to do that. I think in Mumbai, at least in Ashokan area, what I've seen is the cultural aspects which keeps older adults alone. As in, we've had cases where the patients have daughters, so, and then they when they're alone, like when the spouse is passed away and they're living alone, they don't want to go and live with their daughter's house, then their daughter's house, their mica, what they call. So that becomes difficult. Even when the daughters really genuinely want to take care of them, they feel helpless because the parent doesn't want to come and live with them because of the societal norms, ki aisa nahi. So that's something I've seen. Of course, the joint family systems are still there, but this is something that I've seen in commonly in Mumbai.
And for the daughter, the son-in-law also has to cooperate. If son-in-law does not cooperate, then it becomes an issue.
True.
Yeah, so there are multiple issues, very complex issues, but we'll have to, each one case by case, depending on the situation, we'll have to guide them and help them.
True, very true. Yeah. Thank you so much, Dr. Manoj. I think the floor is open for questions from the attendees. If you want to ask anything to Dr. Manoj.
Yes. Yeah, we can open the session out. Thank you so much, Dr. Manoj and Sharon.
Welcome.
Thank you for the, just the discussion. I think it has helped us understand things, especially how we can care for the older generation. And we will also be there in some time. So we need to know, this is for us also, this is education for us. So thank you very much for taking the time and helping us with that. So I want to open the session out to anyone in the audience who's participating would like to ask any questions. I don't see any questions in the chat box, but if anyone wants to unmute and ask any questions, please do so.
Good evening, doctor. I have a small question for you.
Yes, please.
My name is Felix Delima. I'm in Mumbai. And my question to you is there something called a living will? You know what I mean? Like,
Yeah.
I'm 68 years old, and my elder brothers have had dementia. So like my parents also did. So I'm wondering whether I'm also going to be up and about for that.
Not necessarily.
Yeah. I've been fairly active, so I'm fairly active. I walk a lot. I mean, that's the bare minimum exercise I can do. And my worry is that I am forgetting things. My doctor says it's not, it's only a part of aging, but it's not that or whatever it is. But is there anything that we can do? And if you cannot avoid dementia or something like that, is there a way today that you can make a living will where, so that just like you said, the family suffers. Actually, apart from the person suffering, it's the caretakers and the family that suffers a hell of a lot.
Yeah. Now, living will, there are two components to living will. One is about the care and treatment that needs to be given towards the end of life. You can actually write down beforehand that I don't want to be put in an ICU with the ventilation. I don't want to be, to undergo any dialysis or something like that. Any invasive procedures, you can actually put it down in writing beforehand and say that these are certain things that I would desire to do. These are things I do not want to do. That is something that actually can be written down. And I don't know about the registration part. I don't know whether registration is needed or not, but I'll just check on that and get back to you.
Thank you, doctor.
Now, the second thing is about your own, your assets. Most people, what happened, they don't write down the assets will for passing on the assets to their children, and they suddenly lose their memory. They don't remember which bank, which account is there, which FD is in which bank. There's no record of anything, and the children actually are lost, and then they can't withdraw this money also because they have not given nominees. So when it's always advisable for people, my dad, when he developed dementia, I mean, he developed very advanced dementia because of Parkinson's. But when he was 65 or 66, I think at that age, he died when he was 82. He wrote down a proper will about the land, the house will go to which son, the land, how will it be divided, how will the way be, everything. He got it registered. So after he died, we had no problem. We just went to the government office and got the whole thing changed in our names. Especially also financial assets like FDs. Most people don't put nominees. They just put their name or their spouse's name. And when both of them die, the children can't withdraw the money from the bank because there is no nominee. So it's always good to have all the FDs to have nominees. So some of these basic financial matters, assets, the end of life treatment that you desire, don't desire, can all be done properly so that it becomes easier for the caregivers.
Yeah, thank you, doctor. Thank you, doctor. Yeah, I'm in the process. I'm in the process of making my will this week itself. But I was only thinking of the living will. Is it to be included in the will or written separately?
No. That's separate. That's totally separate.
Okay.
That will not come in the will. The will be something for your property and assets and financial things.
Yes.
Living will is not for that. Living will is mainly for your end of life treatment and those kind of things.
Thank you, doctor. Thank you so much.
Anyone else has a question? Can take. Okay, I think there are no questions. I think your whatever you have taught us, whatever you have taught us has been a huge blessing. So thank you so much, Dr. Manoj. Thank you for agreeing to do this with us.
Thank you.
And I'm sure whatever people have heard, and we will be putting this up also on the YouTube channel, it will be a blessing to many.
Thank you.
So God
Vinita,
bless you.
can I just
Yes.
read this one thing I got?
Sure.
A living will is a legal document that allows a person to specify their medical care preferences when they are unable to do so themselves. In India, living wills have been legal since 2018, when the Supreme Court ruled that people have the right to die with dignity and refuse artificial life support, which includes ventilation. However, the process for creating a living will is not widely available in India. And there are certain requirements that are needed. You can look up Google, it will give you all details.
Yeah, thank you, doctor. Thank you so much.
Yeah, just type Living Will India, you'll get it.
Okay, I'll do that. Thank you so much.
Welcome. Sorry, Vinita, please carry on.
No. Thank you. That was needed. That's also a topic that people keep asking us. Yeah.
Thank you, Vinita. Thank you, Sharon, for all that you are doing for us.
Thank you. Thank you for joining, all of you all. God bless you all.
Thank you.
Thank you so much. Thank you. Bye-bye.
Thank you.